Hello everyone, I'm Dr. Devanshi and I welcome you to our new episode. Unveiling the truth, debunking myths and embracing facts in respiratory health. Also, we shall discuss regarding safety precautions that are to be taken while performing your breathing exercises. Myth 1. Respiratory medications are addictive, habit-forming and lose their effectiveness over a period of time. No. The fact is that respiratory medications are not at all habit-forming. They are not addictive and do not lose their effectiveness over a period of time. They help in controlling and reducing your respiratory symptoms. They are also very effective in reducing your inflammation. So do not miss your medications. Myth 2. Patients with respiratory conditions should not engage themselves in variety of exercises, play sports or perform strength training. Fact. Patients with respiratory conditions should definitely engage themselves in a lot of sports and strength training. Myth 3. In case of asthma, they say that if you aren't wheezing, it's not asthma. Fact. In case of asthma, you might or might not have wheezing. It's not necessary for you to wheeze in order to be diagnosed with asthma. Asthma has many other symptoms like shortness of breath, cough, chest pain, etc. Myth 4. Only smokers can develop respiratory condition. The fact is that it's not necessary for you to be a smoker in order to develop a respiratory disease. Various other factors like occupational, environmental, genetic and pollution can lead to respiratory conditions. Hence, not always will a smoker be diagnosed with a respiratory disease. Myth 5. Quitting smoking will not help since the damage is already done. Fact. Quitting smoking will definitely help no matter when you stop. It will help in rebuilding your lung capacity and improve your lung health. Myth 6. Exercises worsen respiratory health. Fact. Exercises do not worsen respiratory health. In fact, if performed regularly, they help in building your lung capacity. They help in your recovery with respect to your respiratory conditions. The only thing is you will have to consult your cardiorespiratory physiotherapist so that you have an idea regarding how many sets and how many repetitions you are supposed to perform. Myth 7. Utilizing masks is harmful for your lungs and causes suffocation. Fact. Masks do not cause suffocation and also do not reduce the oxygen levels in your lungs. In fact, they protect you from harmful particles like dusts, moles, etc. Masks are very good for public health as well as your respiratory health to prevent you from coming across triggers. Myth 8. If you have a respiratory condition, you should not engage in outdoor activities. Fact. It is completely fine to participate in outdoor activities if you have a respiratory condition. In fact, it helps your heart to pump better and increases your cardiovascular endurance. Only thing that you should keep in mind is that do consult your cardiorespiratory physiotherapist before engaging in any activity. Now that we have discussed regarding so many respiratory myths, let us also discuss few safety precautions that you must take while performing your breathing exercises. 1. Start slowly and gradually. Make sure that you begin your exercises at a very low intensity and only then progress to a higher intensity. Second, do listen to your mind and body. When your body is extremely tired, choose not to exercise or exercise at a low intensity. Do not exert your body beyond its limits. Third one on the list is knowing the technique of performing your breathing exercises. Make sure that you learn the technique of performing these breathing exercises from your physiotherapist. The next one on the list is using appropriate equipments while performing your breathing exercises. Make sure that your physiotherapist tells you which equipments are good for your breathing exercises. The next one on our list is doing an appropriate warm-up and a cool-down session. Make sure to perform all your warm-up exercises before you begin your breathing exercises. Also, spend 5 minutes on your cool-down exercises so that you can be relaxed after your breathing exercises are over. The next one on your list is regular monitoring. Always remember to monitor all your symptoms. Your environment matters. Make sure that you exercise in a very peaceful environment. Make sure that the place is very well ventilated. The next one on your list is, guess what? Do you remember? It is reporting your signs and symptoms to your physiotherapist. The last one, but not the least, is follow your schedule from time to time. Remember to follow your exercise schedule according to the repetitions and the sets prescribed to you. Now that we have discussed so many safety measures, I hope they help you in your journey towards better lung health. If you like this video, do not forget to watch our next video. In the next video, we shall be discussing a very important topic. So we are going to discuss few hazards caused due to smoking and also few strategies that will help you quit smoking. So do not forget to watch our next video and stay tuned to Breathe Free.